Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Posterior tibial tendonitis signs and treatment. Posterior tibial tendonitis is a common problem that occurs when one of the tendons on the inner side of the ankle becomes damaged. This can lead to foot and ankle pain, as well as other issues. /r/n/r/n treatment varies depending on the severity of the condition and may include rest, immobilization, medication, physical therapy, orthotics, shoe inserts, and surgery. /r/n/r/n The posterior tibial tendon helps support the arch of the foot while walking or running. /r/n/r/n The posterior tibial muscle attaches to the back of the shin bone. The posterior tibial tendon connects this muscle to the bones of the foot. A tendon is a thick cord of tissue that attaches a muscle to a bone. /r/n/r/n The posterior tibial tendon passes down the back of the leg, not far from the Achilles tendon. It then turns under the inner side of the ankle. Here, it attaches to the sum of the bones of the foot. /r/n/r/n Posterior tibial tendon problems usually occur just underneath the inner side of the ankle, called the medial malleolus. The medial malleolus is the end of the shin bone, the tibia. It's the big bump you feel on the inside of your ankle. The posterior tibial tendon wraps just underneath the medial malleolus. /r/n/r/n This area of the tendon is particularly prone to problems. It exists in a watershed zone, where the blood supply is weakest. So when the tendon becomes injured from trauma or overuse, the body has trouble delivering the proper nutrients for healing. /r/n/r/n Most commonly, people with posterior tibial tendonitis feel /r/n/r/n Many people with this condition report having had a recent ankle sprain. However, some will have had no recent injury. The tendon can also be damaged from overuse. /r/n/r/n This video has been medically reviewed by Oluseun Olufade MD.rnrn As the condition gets worse, the foot's arch can flatten, and the toes begin to point outwards. This is the result of the posterior tibial tendon not doing its job to support the arch of the foot. /r/n/r/n When left untreated, posterior tibial tendonitis can gradually bring on a problem called adult acquired flatfoot deformity, AAFD, also known as a fallen arch. This condition typically begins with pain and weakness of the tendon. /r/n/r/n As after advances, the ligaments, tissues that connect bones to bones, of the foot are affected. The foot joints may no longer line up correctly and may become set in the wrong position. For this reason, early treatment is important to avoid or slow progression to the later stages of AAFD. /r/n/r/n A podiatrist, doctor who specializes in foot and ankle problems, or orthopedic physician can diagnose posterior tibial tendonitis by physical examination. People with the condition have /r/n/r/n If the examination is unclear or your doctor is considering surgical repair, they may order a magnetic resonance imaging (MRI) scan. The MRI can determine whether the tendon has ruptured and where. It can also show inflammation surrounding the tendon. /r/n/r/n Posterior tibial tendonitis is classified according to the stage of the condition. Stage 1 through Stage 4 indicate increasing deformity, abnormal shape, of the foot as the condition progresses. /r/n/r/n As these stages progress, more extensive treatments are needed to correct the problem. /r/n/r/n Non-surgical treatment can be used at any stage. However, the chances of success with these options decrease as the condition progresses. /r/n/r/n How to fix posterior tibial tendonitis depends on the stage of the tendonitis. In the early stage, it usually involves rest and non-surgical treatments. Later, it may require surgery. /r/n/r/n. The initial treatment of posterior tibial tendonitis is to reduce inflammation and stabilize the foot with physical therapy and orthotics. Rest may also be helpful, but avoiding all walking is unnecessary as a first-line treatment unless symptoms are severe. /r/n/r/n. Options for early treatment include /r/n/r/n. Research suggests that kinesiotaping may help reduce improper movement of the functional posterior tibial tendon and increase tibialis anterior muscle in lower leg, activity. /r/n/r/n. Surgical treatment of posterior tibial tendonitis is controversial. Surgical options vary depending on the extent of the condition and include /r/n/r/n. Posterior tibial tendonitis is a condition that results in pain on the inner side of the foot and ankle. It may cause instability while walking. Over time, the condition can lead to the arches becoming flattened, a condition called adult-acquired flatfoot deformity, AAFD. /r/n/r/n. Your doctor will diagnose this condition based on a physical examination and imaging techniques. It's best to treat the condition early. Treatment depends on how advanced the condition is. Once in the later stages, surgery is usually needed, and you may lose some function in your foot. /r/n/r/n. Yes, there are exercises that help with posterior tibial tendonitis. However, it's best to contact your healthcare provider before trying any exercises to see which ones will work best for you. /r/n/r/n. The risks include excess bleeding, a blood clot, nerve damage, infection, calf muscle weakness, anesthesia complications, and continued pain in the foot or ankle. However, these can vary depending on your age, general health, the type of surgery, and your foot's anatomy. /r/n/r/n. The first stage of posterior tibial tendonitis involves swelling of the tendon on the inner side of the ankle. Reach out to your healthcare provider if you have concerns about the health of your inner ankle. /r/n/r/n. Compression socks may help with pain and soreness, but more research is needed. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.